for telling us of the wide range of policy strategies underway, led by the WHO, for telling us the kinds of support that the WHO is providing to its member states, and reminding us well of some of the complexities in implementing these changes in member states and supporting our member states. The governance, the complexity of structural reform, indeed, that's one I'd like us to discuss further. The kinds of reforms we need are rather structural, long-term reforms that will not shed savings or accrue efficiencies in the short run, and the realization of that and the fundamental importance of governance. Otherwise, these crises reforms may end up being, we may end up becoming less efficient and undermining solidarity and universal coverage. It's very reassuring as well that both the Commission and the WHO are speaking differently but saying exactly the same points, as well as, of course, the Lithuanian presidency. So for all of us here listening, following that, this is extremely reassuring that there is a total coincidence, a total agreement, not surprising as these organizations work very closely together, but the total agreement as to what are the policy developments, the ways forward. So that's, we're starting in a very good fit today. Monika, and I'm sure you'll be in total agreement as well, representing today one of the organizers, the three organizers of this conference, and giving us a flavor of this beautiful declaration that I know you've been drafting.
Thank you. And on behalf of the organisers, our hosts, the Lithuanian Health Forum, the European Public Health Alliance, the European Patients Forum, and the European Federation of Pharmaceutical Industry Associations, who have come together to support this conference and to support the Lithuanian presidency, it's my honour and my pleasure to be able to present a draft declaration that we have put together as a way to take the messages that we're discussing today forward and to help us deliver those messages to the decision makers and the political leaders within our member states. So, honourable ministers, deputy ministers, Director General, Deputy Director General, esteemed colleagues, ladies and gentlemen, we have heard a lot already. We have heard from three very inspiring and dense interventions about the main issues that we're facing, about the main policy lessons that we have learned, about the actions and the evidence that we have. And we know that health is essential. We have no economic and successful future as a region without health at the centre of it. We have a number of strategies, including the EU 2020 strategy, where we know that the headline targets and objectives will not be achieved without healthy Europeans, which requires us to tackle these issues, to improve health outcomes and to reduce health inequalities. We, as stakeholders supporting you in your work, we're ready to play our part. And we are one of Europe's largest sectors. It is not small to ask us as patients, as professionals, as industry representatives, but also as citizens to step up and help deliver the political leadership, help achieve these objectives. But we do call and we do ask that European leaders work with us to ensure that health systems are sustainable, inclusive and fit for purpose for everybody living in Europe. And moreover, we need to increase the political leadership that we have. It is not enough. It is not enough for us to achieve it. We would like to remind our political leaders, and not our health leaders, because I think our health leaders are the ones who have these messages, but the ones who hold our budgets and our strategies. We would like to remind them that health spending is an investment. It increases productivity and it supports sustainable growth. And investing in health should be acknowledged as a contribution to economic growth and social cohesion. It should not be a secondary priority, an aside, or a mitigating factor to the negative effects of our current economic policies. It should be central. We would like to remind our political leaders that policy making and decisions regarding investment in health and reform must be evidence-based, and they must be taken strategically and not as a knee-jerk reaction to immediate, pressing political or economic priorities. We would like to remind our policymakers and political leaders that health is a priority for citizens. We heard this already today. It is one of the most, if not the most, important issue for people living in Europe when asked. And this is not small, and this was already mentioned by Mr. Sekel. And by addressing health, addressing the issues that matter to Europeans, We increase the hopes and the expectations of our population. We increase the democratic legitimacy of our governments. And it strengthens trust and commitment in democratic processes, and importantly at this time in the European Union. We acknowledge the number of challenges that are faced across Europe, including an aging population, an increase in chronic disease, the challenge of the expense of new essential technologies, and the reduced financial and human resources within our sectors. And this is relevant for all member states. And if addressed properly and appropriately, opportunities are there to reform and address investments for a sustainable future in our sector. The growing inequalities in life expectancy and outcome between and within member states in the recent decades is a huge challenge. And we cannot do that from within our sector. So we request the political leadership to reach beyond and extend into other sectors. We know that we have clear evidence that access to essential services, technology, and essential medicines is worse in Europe's poorer member states, which also exhibit worse health outcomes. We should not ignore this challenge, and we should work together to ensure that we are increasing equality and access from across the member states, from across the Europeans and people living in Europe. We recognise that the new economic governance, which we will talk about later today, is impacting on health governance, and it's essential for member states to ensure that adequate coordination, including cooperation, monitoring and reporting at EU level, is done together. And finally, that health promotion and disease prevention are essential for long-term sustainability. None of these messages are new. We have heard them today. We have been hearing them, I believe, for perhaps 35 years, since Alma-Ati. So what are we asking? Ladies and gentlemen, we know what to do. We know what to do. In our declaration, we are asking to echo Mr. Sekel, we're asking for political leadership. And to echo Mr. Jakob, we're asking for our political leaders to act. The time for talking is over. We know what to do. So we call on European governments and the EU to take immediate action to increase investment in health promotion and disease prevention. First of all, the cost effectiveness of public health is clear. We know that healthcare and costs can be significantly reduced through community-based prevention and health promotion programs. We need to act in order to ensure that those are in place. We know that the introduction of fiscal measures are an effective way to change behaviour. Taxing foods high in salt, sugar, fat, for example, while increasing the affordability and availability of fruit and vegetables. We know that cost-preventing measures such as smoking bans, vaccination, screening for cancer, and tackling problem drinking will have immediate impacts on the health of our population. And we need to invest more in prevention as well as health literacy. Current levels of investment are insufficient, being reduced, and will not help us to achieve our objectives. We need to think beyond the healthcare sector, a holistic approach to health, as many of the drivers of good health and ill health lie outside of our sector. We need to act to ensure that this happens and not merely remains as nice words on the page. And specifically because poverty and social inclusion and the importance of a well-funded and accessible welfare state are at the core of this. Secondly, we need to ensure universal access to high-quality, people-centred health services. Universal health systems are a core part of the value system of European health systems. It is the unique part of our common approach to health. So our health systems must deliver high quality and safe healthcare, that's quite hard to say, and public health services accessible to all, including access to modern medicines. Continuity of care, including access for excluded and vulnerable groups, is essential. Maximising quality of life and healthy life years is critical if we want to control both healthcare costs and to ensure a healthy population as we age. We call for a partnership approach between all parties in the health sector at national and European levels in order to promote and identify effective solutions for equity of access. And we call to ensure that patients and the public are both empowered and supported in the management of their own health, and that their representative organisations are adequately involved in the development of policies and programmes that affect them, ideally through a whole of society approach. And finally, we repeat the call to ensure that the health system reforms focus on cost effectiveness, sustainability, and good governance, as well as are being implemented in an evidence-based fashion. The funding for health systems must be secure, solid, and based on principles of solidarity as well as sustainability. The principles of accountability, transparency, and good governance must be applied throughout the policies and processes surrounding health systems, and public health, as it is essential to ensure that the resilience of our health systems and promote confidence of our European populations and people living in Europe. Member States in the European Union have a responsibility to ensure that the effects of austerity do not adversely undermine health, access to healthcare, or quality of services. We need action to ensure that this doesn't happen, or does not happen beyond what has happened already. That cost-effective investments in healthcare innovations, including innovation in health systems and practices, as well as social innovation and public health innovation, accessible to all citizens, will benefit research, knowledge, and employment, while improve health and the productivity of health systems, as well as reducing disease. And the implementation of effective, cost-effective, and equitable pricing and reimbursement mechanisms, and improved cooperation between different agencies on pharmaceuticals and other goods is an essential part of this process. So we would like to call on European leaders and governments to work with us to help ensure that European health systems are people-centred, sustainable, inclusive, and deliver good health for all. And we offer our support as European civil society to help deliver this. So I would like to invite you, ladies and gentlemen, to contribute to our call. This is the draft. It is available outside as you leave this room on the left-hand side on the table. So please, until 12:30 tomorrow lunchtime, read through our call to action, amend, comment, improve, add, and hand your comments either into the info desk or pin them to the board, which I believe is by the VIP room. And we will collate this and bring this back to you tomorrow. Because together, we must hope, that we can do this. Thank you very much.
Thank you very much indeed, Monika. Thank you for putting this declaration together.